video is from my brother Randy, who is having back trouble right now, and I wanted to show Randy some ideas for stretching out. Lower back problems, a lot of times, especially with cyclists, can be linked to tension in the back of your legs, hamstring and stuff like that. So if you can stretch out your hamstrings, it takes the pressure off the pulling on the back, the lower back, and a lot of the cyclists I know have lumbar, I guess it's called lumbar, the L7, or L5 through L7, whatever, parts of their spine. So anyway, this is what I've come up with after seeing a chiropractor for my problem and a broken back a couple years ago. So normally what you want to do is you want to take a bike inner tube, usually I pull the valve stem off of them before I use them, and you put the foot, and the idea is at first, of course, you're probably not going to be able to get it to come up very much, maybe this much, if you've got a lot of tension in the back, but you're going to start by lifting up your leg like this, and you're pulling on this tube, either with one hand holding both sides or two hands, depending on how you want to do it. The other leg's laying straight out flat like this. You want to keep this leg straight, the bottom leg straight, and pull up as far as you can, comfortably pull it, and you'll feel like after a little bit, it starts to relax a little bit. You may be able to make it go up a little bit further. But the idea is you want to make this stay straight, not bent. However, using your knee to bend your leg and then straightening it back up, pushing out like this against the tension of the tube will help you to get more stretch on your leg, and eventually you'll be able to get it up to a level somewhat maybe like this. So then the other thing you want to do is you want to work all aspects of the stretch. So this stretches, of course, the back of your leg this way, but you want to also take it the other direction this way and take it to the right as well. So often, I'll start off going to the right first. Again, bringing your leg out like this. You want to let the stretch sink in. It's got to go for a while. Keep the other leg straight. Keep your back on the floor as much as possible while you're doing the stretch out to the right. So I've got both parts of my hip on the ground while I'm pulling out this way, and I'm letting this leg I'm feeling the stretch right now. It's real tense and it's starting to loosen up a bit. Again, if you want to get a little bit more of a stretch and bend your knee, pull it towards you, push your leg out. The idea is push your leg out more. You can feel it start to separate back here and the blood flow start to kick back into your back where it's been tense. So I'm stretching that out, pushing out as far as I can. And I'll do the same thing on the other side. I'm going to show you with my other foot now what I would do if I was taking over. So I've got this leg up like this, and I'm taking it over this way. When I bring my leg over this way, my hip does have to come up so that it's perpendicular with the floor on this side. This leg stays straight, and again, same thing, bend the knee if you want to, and push out. And what you want to do is really just push out as far as you can, like you're trying to reach as far as you can, and that reach will help to separate. You can feel it all down through your back here. Open up your back, and again, help the blood flow to start to come back into your back. The whole, when you're done here, you basically should have range of motion eventually over several weeks, I guess, or months, of a 90-degree angle that you can take to this side all the way over